Ready to ace your board exam? Let's tackle neurologic disorders with this quick quiz, rationale included. Let's go. Question number 1 about stroke diagnostic test. A 56-year-old client with a history of hypertension presents with weakness on the right side of the body, slurred speech, and difficulty understanding language. The nurse suspects a stroke. Which diagnostic test will provide definitive information about the type of stroke the patient is experiencing? A. Electroencephalogram or EEG. B. Computed tomography or CT scan. C. Magnetic resonance imaging or MRI. D. X-ray of the skull. The answer is letter B, computed tomography or CT scan. In the acute setting of a suspected stroke, a non-contrast CT scan is the fastest and most accessible imaging to determine whether the stroke is ischemic, caused by a clot, or hemorrhagic, caused by bleeding. Immediate differentiation is crucial because treatment pathways differ significantly. EEG is for electrical activity in seizure disorders. MRI is more detailed but takes longer and is not first line in emergencies. Skull X-ray is irrelevant for stroke. Next, question number 2 about Parkinson's disease medication. A nurse is caring for a patient with Parkinson's disease. Which of the following medications is commonly used to manage the symptoms of bradykinesia and rigidity in Parkinson's disease? A. Levodopa. B. Acetaminophen. C. Furosemide. D. Prednisone. The correct answer is A. Levodopa. Levodopa is the gold standard for treating Parkinson's disease symptoms. It converts to dopamine in the brain, replenishing the deficiency responsible for bradykinesia, rigidity, and tremors. The other choices are not used for Parkinson's: acetaminophen for pain, furosemide for fluid overload, prednisone for inflammation. Next, number 3 question about seizure first response. A client with a history of epilepsy is admitted for a routine checkup. The nurse observes that the patient is having jerky movements of the arms and legs, loss of consciousness, and frothing at the mouth. Which is the most appropriate immediate nursing action? A. Hold the patient's tongue to prevent biting. B. Position the patient on their back and restrain the movements. C. Protect the patient from injury by moving surrounding objects. D. Administer an anticonvulsant injection immediately. The correct answer is letter C, protect the patient from injury by moving surrounding objects. The immediate goal during a seizure is to prevent injury. Clear the area, pad the head, and never restrain the patient or put anything in their mouth. Holding the tongue is dangerous and a common myth. Medication like anticonvulsants may be given after the seizure if prescribed. Next, question number 4 about home safety in Alzheimer's disease. A nurse is teaching a client with Alzheimer's disease about safety at home. Which statement by the client indicates the need for further teaching? A. I will use a nightlight to prevent falls during the night. B. I will keep my medication in a locked box out of reach of children. C. I will set the oven to cook food and leave the house for errands. D. I will label drawers and cabinets for easy access. The correct answer is letter C. I will set the oven to cook food and leave the house for errands. This behavior reflects poor judgment and is unsafe. Alzheimer's patients may forget they left appliances on, increasing fire hazard risks. Statements A, B, and D promote safety and support independence. Next, question number 5 about pathophysiology of multiple sclerosis, MS. The nurse is caring for a patient diagnosed with multiple sclerosis or MS. The nurse understands that MS is characterized by which of the following? A. Degeneration of dopamine-producing neurons in the brain. B. Inflammation and demyelination of nerve fibers in the CNS. C. Increased acetylcholine levels in the brain. D. Overproduction of cerebrospinal fluid. The correct answer is B. Inflammation and demyelination of nerve fibers in the CNS. Multiple sclerosis is a chronic autoimmune disorder where immune cells attack the myelin sheath, leading to disrupted electrical impulses in the brain and spinal cord. This results in muscle weakness, vision problems, and balance issues. It's not related to dopamine, Parkinson's, acetylcholine, myasthenia gravis, or CSF overproduction, hydrocephalus. Next, question number 6 about nursing priority during acute stroke. A nurse is preparing a care plan for a patient with a stroke. Which of the following interventions should be prioritized in the acute phase of stroke management? A. Administering analgesics to relieve pain. B. Maintaining the airway and providing oxygen therapy. C. Encouraging early mobilization and rehabilitation. D. Educating the patient about lifestyle changes. The correct answer is letter B, maintaining the airway and providing oxygen therapy. The primary concern in the acute stroke phase is A, B, and C, airway, breathing, and circulation. Stroke can affect the brainstem or consciousness, risking airway obstruction. Pain and education are important but are secondary priorities in the acute phase. Next, question number 7, about nursing assessment for increased ICP. Which of the following is a priority nursing assessment for a patient with increased intracranial pressure following head trauma? A. Assessing for signs of dehydration. B. Monitoring for signs of respiratory distress. C. Checking the pupil reaction to light. D. Evaluating for peripheral edema. The correct answer is letter C, checking the pupil reaction to light. One of the earliest signs of increased intracranial pressure, ICP, is a change in pupil size and reactivity. Unequal pupils or sluggish response can indicate pressure on cranial nerves, particularly CN3. Other signs like respiratory changes may occur later. Next, question number 8 about warfarin monitoring. A nurse is caring for a patient with a history of cerebrovascular accident, CVA, who has recently been started on warfarin. Which laboratory test is most important to monitor while the patient is on this medication? A. White blood cell count. B. Prothrombin time, PT, and international normalized ratio, INR. C. Hemoglobin and hematocrit levels. D. Platelet count. The correct answer is letter B, prothrombin time, PT, and international normalized ratio, INR. PT/INR monitors warfarin effectiveness. The therapeutic INR range, commonly 2.0 to 3.0, prevents clot formation while avoiding bleeding. White blood cells, hemoglobin, hematocrit, and platelets are monitored for general health but do not reflect anticoagulation status directly. Question number 9 about dysphagia in patient with Parkinson's. A client with Parkinson's disease is experiencing difficulty swallowing. What is the nurse's best intervention? A. Encourage the patient to eat large meals quickly. B. Administer medications with a full glass of water. C. Provide soft, moist foods and thickened liquids. D. Allow the patient to skip meals to avoid discomfort. The correct answer is letter C, provide soft, moist foods and thickened liquids. Dysphagia is common in Parkinson's and increases aspiration risk. Soft, moist, and thickened textures reduce choking. Eating slowly, upright positioning, and supervision are also vital. Large meals or skipping meals worsen nutritional status. Last question number 10, about phenytoin discharge teaching. A client with a history of seizures is being discharged from the hospital with a prescription for phenytoin. Which of the following should the nurse include in the discharge teaching? A. It is important to take this medication with an antacid for better absorption. B. Do not abruptly stop taking this medication without consulting your healthcare provider. C. You should take the medication on an empty stomach for better effectiveness. D. It is safe to drink alcohol while taking phenytoin as long as it's in moderation. The correct answer is letter B. Do not abruptly stop taking this medication without consulting your healthcare provider. Sudden cessation of phenytoin can cause rebound seizures. It must be tapered under medical supervision. Antacids can decrease absorption. Alcohol use increases seizure risk and interacts negatively with phenytoin. Want more board-style questions like this? Subscribe and follow at NurseNextStation for daily rationales and quizzes.